Hi everyone, Dr. Stephen Huss here from resourceyourhealth.com. In this video, I want to discuss some aspects of the blog post I did recently about the true cause of heart attacks and some of the interesting observations we see when it comes to heart attacks and when they happen. So for the exact mechanistic details of what does cause a heart attack, the majority of heart attacks, refer to that blog post. I'm not going to go into that in this video. I'm going to focus more on these observational aspects. But real briefly, the three imbalances that cause a heart attack are one, that we're not fat adapted. So we don't have the ability to readily burn fat when they're available, and our body is more wanting to burn glucose. So to do that, we would need to get into ketosis by restricting carbohydrates or intermittent fasting and things like that. The second imbalance is increased oxidative stress, which is an increase in free radicals in our body. And our body makes these just by making energy, but we also get free radicals whenever we are exposed to lots of toxins in our environment. But relying on carbohydrates for fuel rather than fats will also increase our oxidative stress. And that oxidative stress will deplete nitric oxide. And that depletion of nitric oxide is a key factor in what causes heart attacks. And the third one is an imbalance in our stress response. So this can happen when we get stuck in a fight or flight state, or even a low grade fight or flight state. And that imbalanced stress response can predispose us to having a heart attack. And the best measure of a balance in our autonomic nervous system and our stress response is heart rate variability. So those are the three imbalances that cause heart attacks, and for the exact details of how those three imbalances cause a heart attack, go back to the blog post called "It's Not Blockages, So What Really Causes Heart Attacks" at resourceyourhealth.com. However, I want to discuss here in this video some of the interesting observations we see with heart attacks. So one of them is that heart attacks are more common in the elderly. So as we get older, we see more heart attacks. And part of the reasons that could be is that there's studies that show that heart rate variability, the measure of our stress response, declines naturally as we age. And there's nothing that we can really do about that. Just that, I mean, we can definitely increase our heart rate variability, but as far as just a normal dropping of that as we age, that's just how it happens. The other thing is that there's research that shows that as we age, we lose the ability, our heart loses the ability to utilize fatty acids and ketones for fuel, and that's just another process of aging. Obviously, being fat adapted will help with that, but that's just one of the two reasons why we see heart attacks more common in elderly. Another interesting observation is that during heart attacks, there's been studies that show that oxygen levels don't change in the heart tissue throughout the entire event. So if heart attacks were caused by blockages that block blood flow to an artery, you expect oxygen to drop because the blood's not getting to the artery, and that's what carries the oxygen. So this goes to show that there must be some other mechanism that's causing a heart attack, and I think I've outlined that in the blog post that I did. Another interesting observation is that males have heart attacks more commonly than females, though females are catching up. But also males tend to suffer from them earlier in life than females do. And an interesting observation here is that a menstrual cycle, which females have, has been shown to increase heart rate variability or have an effect on the parasympathetic nervous system. And males don't have that. So could it be that this monthly cycle of a female is protecting them earlier in life from this autonomic nervous system imbalance that males seem to be suffering from and having heart attacks sooner? Maybe, I don't know. Another interesting observation is that heart patients, people who have already been diagnosed with congestive heart failure and atherosclerosis, things like that, tend to do worse in winter and die more often in winter. But also heart rate variability has been shown to be decreased in general in winter. To me, that's because we're spending less time outside, less contact with nature, and those things are known things to be stimulating to our heart rate variability and our autonomic system balance. Another one is that heart attacks are more common on stressful days of the year. So there's studies that show that they're more common on holidays or around holidays, around sporting events, stressful sporting events. That tends to be stressful for people, but also Mondays. Heart attacks are more common on Mondays. And so this whole idea that this imbalanced stress response in these stressful situations, stressful days of the year, heart attacks are more common makes a lot of sense. And then lastly, the last kind of observation that we see is that there are certain drugs that, while not intended to prevent heart attacks directly, tend to have that effect. So there's drugs like ACE inhibitors and beta blockers which are used for heart patients, they tend to have they're associated with a decrease in heart attacks, and it's also been shown that those drugs help increase heart rate variability, help stimulate the parasympathetic nervous system. So could the effect that they're actually having in preventing these heart attacks, it's a slight effect, but it's still an effect. Is it because they're stimulating the parasympathetic nervous system? Maybe. And then the other drug that's been shown to pretty effectively have a decrease in the number of heart attacks is nitroglycerin tablets. And that's going to provide your body with more nitric oxide. Remember I said that oxidative stress will decrease nitric oxide, which is a huge player in what causes heart attacks. So it could be that these nitroglycerin tablets are providing us more nitric oxide, which is preventing those heart attacks. So those are some interesting observations that kind of confirm this theory that I have that the majority of heart attacks are not caused by a blockage, but are caused by this series of events that creates a forced metabolism shift in the heart, which causes all kinds of problems, which you can read about in that blog post. All right. If you like this video, please like and share it wherever you think people would benefit from it. Otherwise, that's it for now. Stay healthy out there.